Hello and welcome to this fourth edition of CREGÉS COVID-19 Interview regarding social issues in aging in the context of this pandemic. I am your host, Mélanie Couture, institutional researcher at the Center for Research and Expertise in Social Gerontology, CREGÉS, of the CIUSSS Central Montreal. For this interview, we will talk about COVID-19 pandemic has negatively impacted older adult social engagement. We will try to understand the phenomenon of pandemic precarity and how the pandemic has pushed it into the forefront. We will also explore possible solutions to counter ageism in this context. For this CREGÉS COVID-19 interview, we will have the pleasure of having two CREGÉS researchers from Concordia University who also began their careers working as recreation and music therapists in the healthcare system. Dr. Shannon Hebblethwaite is an associate professor in the Department of Applied Human Sciences and the director of ENGAGE, Concordia Center for Research on Aging. Dr. Laurel is an associate professor of music therapy in the Department of Creative Arts Therapies and is also associate director of ENGAGE. Hello, Shannon and Laurel. Thank you for being here with us today. So the first question I'm going to ask is actually, what is pandemic precarity?
Yeah, it's an excellent question, and it's something as we were thinking through and living through the pandemic that we started to reflect more on, and it's evidence in a paper that we wrote. And so just first, I'd like to acknowledge also our third co-author on the paper, who's Tristana Martin-Rubio, who's our coordinator at ENGAGE and a PhD candidate in philosophy at Duquesne University in Pennsylvania. So thanks to Tristana for all of her help on this paper as well. So according to Judith Butler, really this idea of precarity is a condition that people experience that's caused by the unequal social and political environments. This results in really a failing social and economic network of support that differently exposes some people to more injury, violence, and death in their lives. And so we've seen during the COVID pandemic that older people can suffer from very unequal access to material goods, to care, and from diminished social networks. And so this causes us to question both life and care, and we are concerned about how society devalues aging. And this puts older people at risk of abandonment and mistreatment. So specifically around the aging piece, Amanda Grenier and Chris Phillipson talk about precarious aging. And they suggest that care becomes a really key turning point for amplifying the risks and the insecurities that are produced over the life course and reinforced in the context of declining social commitments and economic austerity. So the three of us in our paper that you can access online through the CREGÉS website, we argue that the COVID-19 pandemic didn't create this situation of precarity, but what it did was it made it worse, and it certainly made it more visible. So this idea that we propose of pandemic precarity really illuminates these underlying problems and a chronic underfunding of the health and social service system by governments of all stripes over the past 2 decades. This wasn't a problem that was new. Sadly, it didn't surprise many of us. So age, though, by itself, we argue, has been really wrongly framed as the problem. So as Shelley Tremaine argues, it's of the vulnerability that we've heard so much about during the COVID-19 pandemic. It's not inherent to age itself, but rather older people have been rendered vulnerable by these systemic, attitudinal, institutional, and cultural circumstances. So things like ageism, financial instability, precarious housing situations, social exclusion, and of course, health inequalities. So it's pretty clear that this COVID-19 pandemic and the associated physical distancing practices have certainly made us more aware of the experiences of older people who are very regularly, sadly, subjected to marginalization and isolation. So there's a really telling example from Tommy Dunn, who's a dementia advocate and a person himself living with dementia, who said early on in the pandemic, he said, "This coronavirus will have given many people their first taste of social isolation, being told when you can go out, who and how many you can meet. Having dementia is like this all the time."
So from what I understand is actually, precarity was there before the pandemic. And what you're also saying is that vulnerability is actually more of a social process than because of aging itself. Am I correct when I say that?
Yeah, like it's not age that makes you vulnerable, it's the systems that don't support you, right? To age well and to be healthy and to engage socially in your communities.
Okay. And one of the questions I had, since you're both in leisure arts, so tell me how leisure and the arts have been implicated in the pandemic for older people living in the community and also in long-term care.
I'll start with that. In our specific context in Montreal, Canada, older adults really are in a position of acute precarity, as Shannon has mentioned. And as we have implicated previously, the pandemic has not caused lack of access either to arts and leisure services or activities, but has revealed existing problems in that particular area. So research indicates that approximately 35% of adults over the age of 65 live alone. 28% report difficulty buying goods and accessing services. And only 50% of those over the age of 75 access the internet regularly, which reveals a digital divide between generations and within generations. So furthermore, care providers, which we are including recreation and creative arts therapists as care providers, or considering them as care providers, those individuals are made vulnerable also by the precarious nature of their working conditions, which in turn reinforces the fact that the lives of older adults are being devalued. Many leisure and arts professionals who work with older adults in various contexts, including many in long-term care, find themselves in a position of precarity, working at multiple facilities and making low hourly wages. We have been told in some cases as low as $15 to $18 per hour, with no job protection or benefits. So this devaluation of a comprehensive professional care for older adults has resulted in unacceptable neglect. So better quality leisure and arts services must be enabled to help foster provision of person-centered care in a safe way, with those professional workers receiving appropriate compensation and job security in order to change the present and past unacceptable situation and to prevent similar future tragedies. As Shannon also pointed out, provincial governments have established only minimum standards because of austerity measures for the provision of leisure and creative arts services. So they're often only requiring one individual with quote unquote related, not necessarily specialized training, to assume a designated lead role, left to depend on volunteers for help in providing these services. And due to large resident to staff ratios, facilities have resorted to large group leisure and arts programming, which is definitely not suitable for all individuals. And furthermore, it's unsustainable when physical distancing measures have to be implemented.
We saw that.
Yes, yes. So of course, well-organized volunteer programs are important. And of course, volunteers do incredibly valuable work. But as Armstrong says, care work is skilled work. And so a comprehensive and humane realization of care must include a range of professional, leisure, and creative arts services so that older adults can have meaningful opportunities to fulfill their unique individual potentials in context. And this goes well beyond meeting their basic physiological needs. And by treating older adults in any other way, what we are saying effectively is that older lives then appear to matter to different degrees.
So what you're saying, this is interesting because you're saying you're having many ideas within what you're saying. So the idea is that since there's somewhat systematic ageism in care for older adults, it doesn't only affect older adults, it also affects workers. In gerontology, people who work with older adults, especially those in arts and leisure and recreation. So ageism affects a lot of people, not just older adults, from what you're saying.
Yes, and it's really almost, I don't know if the services that are being provided by professionals are not being viewed as professional services, and they're not being viewed as essential to the care of older adults. And so, yes, of course, the pandemic has revealed a problem with regard to the basic care, physiological needs of older adults
with
not
orderly
being addressed.
example.
But what we're saying, we have to go beyond that. We have to look at the whole person, because looking at the whole person is going to affect their health and well-being moving forward in a much more positive and appropriate way. That's what we all want. We want to live our lives as whole people. And why shouldn't older adults have the same opportunities as all of the rest of us?
And like you're saying, the pandemic showed that even the basic physical needs weren't met. So of course, psychological, social needs were like not at all met almost. And we saw it in the pandemic, it got even worse. And like you're saying, the fact that people had to be distancing, and then you couldn't do any groups activities, you can't do things online because not everybody's online either, then there was a big problem with that.
And people when people would age, they're not sitting there to wait out their lives, they're sitting there to live their lives. And so we're saying we need, if we really want to take this seriously and really provide appropriate support and care for everybody, then we need to be looking at the whole person and not homogenize aging too. Look at each individual and their needs and the various characteristics that their lives are contained in their lives.
So can you tell me, what are the solutions then? What should we be doing?
Yeah, that's an excellent question. And there's no easy answer, right? When the pandemic started, we were approached, how are you going to solve this issue of social isolation and aging? And I was like, wow, that's a big one, right? And like we said, it's not new. So I think the key piece, it's huge, and it's not going to be solved overnight. And it certainly requires really big changes to our social systems and structures, and also our attitudes about aging, right? And this idea around ageism, it's interesting to me, of all of the isms, aging is something every single one of us is going to experience, yet we still are ageist in our attitudes. So what it's really highlighted for us is the importance of taking, as Laurel alluded to, what we call an intersectional approach to understanding aging. So it's a person's identity is not only their age, right? Our identities are made up of many different characteristics and roles that we participate in. And so traditionally in intersectionality, it has this goal of bringing to light those relationships between those multiple intersecting identities. But what tends to happen is people tend to focus a lot on race, class, and gender, sometimes sexual orientation, not as much, but age and ability or disability are often overlooked in this discussion. So it's important for us, of course, race, class, and gender are important, but it intersects with age and ability always. So this is what an intersectional lens means, is that we, like Laurel said, we really question this homogenization of older people. Older people aren't all the same. They are as different as you and I are, right? And so it encourages us really to account for these different characteristics, like I said, gender, race, ethnicity, sexual orientation, disability, class, marital status, place of residence, your care roles that you take on in your life, and different associated inequalities, right? We very seldom think about people who are imprisoned or experiencing homelessness, and that's also been a huge issue in the pandemic. And so in thinking about solutions, we really kind of caution people against these sort of policy measures that reinforce this ageist discourse that devalues older lives, viewing people over a certain age as sharing a particular set of characteristics, right? We saw it was very clear from the beginning, age 70 and older, do not leave your house. That was a very clear message from public health. Older people were the first people to be forced to isolate. And they're going to be the last ones who are allowed out again, right?
I actually had to go on the web to see what other types of people were vulnerable to COVID. They were always talking about 70 years old, and then they said, and other vulnerable people or with health conditions. And I said, which one? So I had to go on the government website to actually look and see, okay, diabetes, lung problems, and because they weren't talking about it, they were only saying age all the time.
Yeah, so there's lots of different things that intersect with age that then make you vulnerable. It's not just age itself. There's some 70-year-old people who are much healthier than some 30-year-old people, right?
But that's the point. So that also made younger people think they were like, they couldn't have it. So, and now we're seeing what's happening. People are going to bars and making COVID parties, and they're all getting it, even if they're 20 or 30-year-olds, and they're getting sick too.
Yeah. So what's really important to us is what Cruikshank talks about as this practice of conscious aging. And I really like this term. And what she suggests is that this involves really what she calls a mindful resistance to age stereotypes, right? We have to unlearn all these things that we've been taught over our lives about what it's like to be an older person. And I think it's really important to understand that this doesn't mean that we're suggesting we set aside our awareness that as we age, there are some challenges and there are some limitations. But what it does do is it really encourages us to really stay attuned to changes in people's capacities, but also these, what she calls these very different material conditions of life, right? That put some older people more at risk than others. People who are living in high density housing and people of lower income and all different backgrounds. And all of those things kind of combine to implicate people's experiences of the pandemic.
So in a way, you're thinking it's not just about other people, it's also self-ageism, like saying something like, I'm too old to do that, since I'm over 40, I shouldn't wear a short skirt. And I think these messages are different for men and women. So it's, like you said, it's about different parts, different identities, and you hear different messages about aging depending on your other characteristics. So,
absolutely.
Okay.
Absolutely, yeah.
And in terms of solutions, I'd like to bring it back just a little bit to the leisure and creative arts piece, and reiterate or expand upon maybe some of the points that have already been made. I think for some people, it might seem trivial for us to be advocating for better access to high quality leisure and arts programs when all we're hearing are these ongoing reports about the basic care needs of older adults not being met. But I really feel, or we really feel, that if we're going to move forward with a comprehensive plan that really genuinely seeks to address the diverse needs of older adults, then leisure and creative arts programs or initiatives that are accessible, that enable them to flourish in context so that they can really realize their potential for living well, are a critical component of this plan. Like most of us, older adults can benefit from activities that bring meaning to their lives. And this goes beyond pursuits solely related to our basic survival needs. Research has also shown that meaning in life is associated with higher levels of resilience, and it helps older adults to maintain better physical, mental, social, and spiritual health. So it's bigger perhaps than many of us realize.
Well, actually, that's what you're saying. I think that more and more people can actually relate to that now because, like you said, Shannon, earlier, because we kind of had a taste of social isolation because of the pandemic and being confined, many of our leisure activities were actually cut also, like going to restaurants, so I think that now everybody had a taste of social isolation, and I think it brings to mind, say, okay, so not having leisure or not being able to do and have activities is hard. You know, and it's bad for your mental health. So I think it's a good moment to be talking about recreation activity for older adults, because now we know how crucial it is because we had our own cut because of the pandemic.
And what did people turn to when this happened?
Netflix.
I mean, people are actually, I would say, I don't have any scientific data on this, but people have turned to leisure and the arts. There have been more online concerts and balcony performances and all kinds of things. I think not just as a way to pass the time or entertain themselves, but to actually reflect upon what was going on, to help them get through what was going on, to make meaning in their lives in the situations within which they found themselves. So I do think that in some ways people, I hope, have some empathy for the situation of many older adults that don't have access to these things, because this is what people turned to when the pandemic happened.
It's also a sense of being together, doing something with other people at the same time.
And feeling that sense of connection not only to others, but to the self, and having opportunities to make choices and self-determination around what it is that you do and do not want to engage in, what you feel will be helpful and meaningful for you, and things that reflect your personal and your cultural identity.
And so what would be your main message to people listening to this interview? So Shannon, what would be your main message? And then Laurel, you can actually tell your message.
Well, I think thinking a little bit about what did we do during the pandemic, right? A lot of us shifted to engaging with things online. And this is something that I've been interested over the last few years in terms of older people and how they choose to or not engage with different digital technologies. So I think it's important for us to reflect on that a little bit, and we understand and we acknowledge, of course, like digital leisure can help facilitate some social connections among older people. I was FaceTiming with my parents on a almost daily basis during this because their social networks were so constrained, right? So there's been really amazing examples of outstanding efforts by health and community practitioners, as Laurel has mentioned, to help people stay socially connected online during the pandemic. However, I think it's really we need to be really careful that we don't kind of get sucked into this, what we call this techno-futurist confidence, right? There's this sense that technology is going to solve all of the problems of social isolation and aging. And of course, it can help, but it's not the only answer. And so we have to really, thinking again in a very intersectional way, I think we have to be really mindful still of the digital inequalities that exist, right? In Canada, you know, your internet plans are the most expensive in the developed world, you know, like it's ridiculous. So thinking about that, owning devices, right? They're increasingly more expensive. And then we have varied digital literacy. You know, we have lots of older people who are very engaged online and are very able to do that, and other people who haven't necessarily had those opportunities in their lives. So I think we have to be careful, because an over-reliance on online stuff can actually result in more alienation and exclusion for those people who can't or choose that they don't want to engage digitally, right? Some of us love social media, me not so much. I don't engage on it, right? So again, it's this homogenization. Not all older people are the same. And it's really important that people understand that when we're going to introduce technology and engage with it, we have to do it well, because if people have a bad experience with that technology in the beginning, they are much less likely to ever try again. And so if we don't do it well at the beginning, it's difficult to change people's opinions about it, even when the devices or the infrastructure or the technology does improve, right? So I think that's kind of, we want people to engage with a good use of technology. So we want conscious engagement, careful, thoughtful, and also being mindful of the relational aspects, right, related to a lot of these social technologies, and not just kind of this widespread diffusion. Here, we'll give everybody a tablet or a computer and they'll be fine. You know, that's not going to be successful. So we have to pay attention to those social systems that have to be in place for technology to make a difference. Some of those things that I've mentioned, but also content online, language online, community institutional structures. If we think about people living in HLMs, in subsidized housing, many of those folks don't have access in their building at all, or maybe at the very least they have access in a common recreation room. Again, that was impacted by the pandemic. People couldn't be in there, and those are also often under lock and key, right? So I think we need to think more broadly about how people engage that way. So that's would be sort of my sort of final message, is that certainly we recommend that engagement with digital technology is a possibility, but it should be a collaborative and shared decision with older people, right?
It's the same as Laurel said, it's all about choice. So you should have choices, so use it or not, but if you don't want to use it, have something else.
Yeah. And be mindful too of privacy issues, right? This has been an interesting experience as we're, in the pandemic, telling people engage with more things online. Well, if you talk to experts like you and Sarita, who talk about mistreatment of elders, like, we have also socialized them to be afraid and be very careful of not being scammed online, right? So issues of their privacy, of their data, and those sorts of things are important for us to keep in mind.
Exactly. Yeah, and what we learn also, it's all about social interaction. If you want people to use technology, somebody they have trust in has to show them how to use it. And also, so it's not about creating on social media new friendship. It's more about maintaining the existing ones and being able to communicate with your family and things like that. Yeah, exactly.
And just building upon that in terms of, even in-person opportunities to engage with technology, even prior to the pandemic, there are sort of attempts to use technology such as in a cost-effective kind of way. So programs such as Music and Memory iPod music listening programs for persons living with dementia, or social prescribing initiatives where people refer patients to social activities as an adjunct to more conventional medicine. Those kinds of things are really well-intentioned, and they can result in benefits, and some benefits, but they really are an oversimplification of all of the ways in which a range of leisure and creative arts programs can help or support a diverse population of older persons. So there's this idea of a one-size-fits-all solution, or a magic pill that we're going to give these people these things, and it's going to, you know, it takes care of their recreational, leisure, and personal needs. And so these initiatives, if administered in this way, they really actually risk marginalizing some older people because they don't address issues related to accessibility, personalization, how these things help in context, quality control, and safety, and in particular for persons living with dementia.
And it's also about choice. It's not because we give you one leisure activity, then we've done our job.
It's like ticking off a box.
Yeah, you're fine. I gave you a ball and we play for 30 minutes, so it's done. So it's more having it also integrated because we had a talk about saying it was only once a week, I think, in long-term care. And who does like leisure activities only once a week for 20 minutes? You're supposed to have it throughout the week to relax. So can you talk a little bit more about the quantity that was there even before the pandemic?
Well, and I think that's part of the issue too, is in doing things like that, you're trying to program to the majority of the population, right? And that may work for some people, but it's like Laurel says, it doesn't address the needs of people for whom that's not a good environment to engage with. Or, you know, just like we said, people's preferences, you know, I'm quite happy to have my own quiet time and do puzzles and read books and those sorts of things. Like, I don't need to be in a group of 50 people playing bingo to enjoy my time. Some people, bless their hearts, like they love the bingo, and that's great.
That's their thing.
Fun, right? So it's about what's meaningful for people. I think about in the pandemic too, right? How popular did cooking and baking become?
Oh,
right?
yeah.
And that's a perfect example. Like, for some people, cooking and baking is really fun and enjoyable, and it's a leisure experience for them. But for other people, it's not at all. It's more, it has more of a work connotation.
It's a chore.
Right? So it's not, it's about people's individual subjective experience of the activity more than the activity itself.
Well, and to add on that in terms of long-term care, I really feel that these kinds of things are things that really need to be integrated into people's care plan. So it's not just this add-on thing where they get their 20 minutes of whatever per week. It's integrated into the daily care plan and to find out what their preferences are, what they like to do, what they want to engage in order to live a meaningful life, and also to be constantly reassessing that over time because people change. So once you come in and you find out that somebody likes this music or likes to do this other thing, you just don't assume that that's what they want to do every day or every minute. It's something, these decisions need to be made with in collaboration on a day-to-day basis.
Yeah, exactly. So it's about living. It's not just waiting for that and being healthy, and that's it. So you need to have fun, have meaningful activities. At any age. It's not just about aging. Anybody needs it, you know.
Well, and create environments where people feel that they feel comfortable and safe and feel like it's their home or their community.
Yeah, and this expression in English we have, it's about thriving, not just about surviving.
Exactly. So thank you very much for all of your ideas and like trying to be less facing less ageism and contributing to ageism also, and trying even in our own lives to have more fun and meaningful activities, even if we're confined again. We don't know yet, but it might happen. Well, thank you very much.
Thank you.